Well, first, let me start with angiopoietin-like 3 as a target. Angiopoietin-like 3 is a protein hepatically synthesized that inhibits both lipoprotein lipase and endothelial lipase. So individuals who have loss of function variants have lower triglycerides, LDL cholesterol, non-HDL cholesterol, and remnant cholesterol. In trials with a human monoclonal antibody directed against angiopoietin-like 3, evinacumab, we reported marked reductions in LDL cholesterol in patients with both homozygous familial hypercholesterolemia, 47% reduction versus placebo, and in people with refractory hypercholesterolemia, 49%. And I led that paper that was also in the New England Journal of Medicine. All right. And I was second author on the homozygous FH paper, also in the New England Journal of Medicine. But because this drug is clearing remnants and, disinhibiting lipoprotein lipase, it's got a marked effect on triglycerides. And we conducted a study looking at people with severe hypertriglyceridemia who had prior pancreatitis. And in those without loss of function biallelic, 2 loss of function variants in lipoprotein lipase, the reduction in triglycerides were 68 to 88%. So the enticing aspect of an ANGPTL3 inhibitor is it's covering the broad spectrum of people with severe hypercholesterolemia, homozygous and refractory heterozygous FH population, as well as severe hypertriglyceridemia. And so that brings us to what's new. Now, Regeneron is not developing evinacumab beyond the orphan indication for homozygous familial hypercholesterolemia. And this may be because the therapy is given intravenously, every month, once a month. So the zodasiran is an RNA inhibitor. And this RNA inhibitor is given subcutaneously. And because RNA inhibitors have a durable efficacy, it's administered every 3 months under the skin. Okay? Thus far, inhibition of ANGPTL3 has only been evaluated at the extremes of cholesterol and the extremes of triglycerides, but not in individuals with more moderate hypertriglyceridemia, more moderate hypercholesterolemia. In the ARCHES-2 trial, we investigated the efficacy and safety of zodasiran in patients with fasting triglycerides greater equal to 150 but less than 499 milligram per deciliter, who had either an LDL cholesterol greater than equal to 70 milligram per deciliter on the background of statin therapy, or a non-HDL cholesterol level greater than equal to 100 milligram per deciliter. And we're presenting the end of the phase 2 study, which we administered zodasiran at day 1, and at 12 weeks, or the 3 months, and then followed individuals for another 6 months, for 36 weeks of follow-up. So that's kind of the outline of the trial.